This is episode 1 of One Thing. We speak to Dr. Geoff Lecovin about metabolic flexibility. Welcome to One Thing. I'm your host, Dr. Adam Rindy. I'm a licensed naturopathic physician in the Seattle area, and I'm the host of One Thing. We are a podcast that brings together thought leaders in the fields of medicine, science, fitness, psychology, and performance. We speak about one core thing that these thought leaders have learned, applied, and integrated into their life and practice in the last 3 to 6 months. Today's guest is Dr. Geoff Lecovin. He's a Kirkland-based licensed naturopathic physician, chiropractic physician, acupuncturist, and master of nutrition. He has been practicing medicine for over 25 years. Dr. Lecovin is someone I met early in my training and became one of my first mentors. I was drawn to his ability to simplify complex concepts in a digestible and applicable manner. Our relationship grew to a friendship over the years. Later, we found out we were distant cousins through 23andMe testing. Please join me in welcoming our guest, Dr. Geoff Lecovin. Welcome to the show.
Thank you for having me. It's a pleasure to be here.
Yes, it's great to connect with you. I'm honored to have you as my first guest on One Thing. Why don't we just catch up first, and can you tell me a little bit about what you've been up to professionally?
Gosh, over the years, I've trying to take my training, and I found that I had all these different tools, and just felt like I needed to kind of hone in and specialize. So over the past, I would say, 5 years or so, it's kind of gone into the direction of sports performance, sports nutrition, and injury prevention, injury treatment. And so my practice focus and my focus in general has been to establish relationships with personal trainers, physiatrists or physical medicine doctors, orthopedists, and just get them to know what I do, refer them patients, and in turn they refer me patients. And so get those relationships going, and then also continue on with my my passion and my education. So that led me to the International Olympic Committee sports nutrition certification, which has been the focus or was a focus over the last 2 years. I just completed the program in December.
Wow, congratulations. That's, you've always been one of these people that I just associate you with, like this insatiable desire to learn, and you seem like you're always gaining more knowledge, and you don't only apply it to your practice, you apply it to your own life.
Yeah, it's a passion for me. So it's kind of like I'm every day I go to work, I'm living my passion, my dream. And I think, like, as a practitioner, if you really enjoy what you do, and it's just it's part of who you are, part of your life. It's just going to work is just like you're practicing life. And so this, I've gone through a number of these sports nutrition certifications, and it's just kind of an insatiable quest for learning. And each of them kind of brings something different to the table. In the last one that I just completed through the International Olympic Committee, one of the final projects was to write a paper that could be potentially published in the one of the sports nutrition journals. And what I did is I tried to take what bodybuilders and physique athletes do in order to attain the physique that they want, and try to apply it to the general population or people that come into my clinic. And that's not to say that I want to train my clients and patients to become physique athletes, but I did find that a lot of the strategies that the physique athletes and bodybuilders use in terms of their nutrition and exercise recommendations can be applied and used very successfully for weight management in general population.
Yeah, that makes sense to me. I mean, I think, if we can study and understand people who have really excelled in an area, or have really learned, how to adapt their bodies to nutrition and fitness for certain outcomes, and to learn from them and study them and apply it to the general public seems like a really, really good way to learn. So, yeah.
Yeah, no, it's what what particularly draws me to these associations like the International Olympic Committee, or there's another one called Guru Performance that's out of the UK that was and still is affiliated with the International Society of Sports Nutrition, is that it's evidence based. It's not based on trends. It looks at what's the evidence and how do we bridge the gap between science and practice. So I really like that idea of like, how can I take the science, bring it into my clinic, and apply it to the patients that I see in order to help them with weight loss, weight gain, performance, or wellness.
So yeah, we're gonna kind of dive into this a little deeper in just a moment here. If you could just share with the listeners, like, when you show up at your office for the day, like what's a typical day? I mean, where do you practice? What's the facility like? And just kind of tell us a little bit about that.
Sure. Okay. Well, I start my day at about 4:30.
Okay.
I get up and just maybe do a little light meditation and then go to the gym and do my exercise at about 5 in the morning. I need that endorphin release and just kind of need to start my day with some kind of activity. And then come home, have a huge breakfast, and then I'm off to work and usually get to work by 7 and spend about 20 minutes or so just kind of reviewing my day, the charts, the patients I'm going to see, maybe kind of go through some treatment plans, and then start seeing patients at 7:30. And so the clinic that I'm at is fairly integrative. There's myself, there's another chiropractor, there's a psychologist, a physical therapist, and several massage therapists.
Oh, nice. So it's kind of like a multi-integrative practice. And so you're kind of seeing patients. How many patients do you see on a daily basis?
So I have 2 long days, whether I'm there till about 6:30 on Monday and Wednesday, and then Tuesday, Thursday, and Friday I'm usually there till about 3 that I can take off and spend some time with my kids. So just anywhere between 15 to 20 patients a day would be my typical schedule, and then generally I'm seeing patients for about 30 minutes, and a typical type of interaction would be either some hands-on thing where I'm doing some trigger point dry needling, which is a neuroanatomical form of acupuncture, combined with manual therapies and corrective exercise. Or I might see people who are coming in for nutrition-based consult to address comorbidities of obesity, or there might be an athlete that's coming in that wants to know what they can do to perform better.
Yeah. I think one of the things that like when I have a patient that's looking for someone in your area of expertise, and I'm talking about you as like someone I might refer to, I always describe you as really dynamic in your approach, and you actually have multiple tools to use based on whatever the patient's dealing with versus sort of just one tool.
Yeah, so that's right. Like people come in and they'll say, well, are we going to do chiropractic? Are we going to do naturopathic? Are we going to do acupuncture? How do you decide? And I really compartmentalize like that. I just kind of see like I have these different tools, and it affords me a larger scope of practice, and I will use it based on what I would recommend to a patient, and then I'll meet them where they're at. So some patients, they want to do acupuncture, or they don't want to do a more high velocity type of manipulation. So we'll just kind of meet them where they're at and what they're comfortable doing.
That's great. Yeah. So, you and I talk a lot, maybe like once every week or every 2 weeks, just we'll share various journal articles and just new things that we're learning from time to time. And it's always, I really enjoy that. So the nature of the show is, we want to kind of zero in on one thing over the last 3 to 6 months that has sort of opened your eyes, changed the way you practice, changed the way that you live your life, or change the way you kind of implement your previous tools and previous learnings. So I just want to kind of go in that direction now.
Sure. Gosh, so it's kind of hard for me to say like just one thing, because like, as with you, I am constantly looking at the research and what the evidence is, what is the evidence showing, And I would say like kind of the biggest thing for me is just staying at the foundation of things. And there's a lot of, there's that buzz term that people call functional medicine that we spoke about earlier. And I would say like for me, it's just getting to the basics, like diet, exercise, lifestyle types of things, and just applying those. And every now and then you'll see these kind of new buzz things that come out, or there's a new trendy diet, and my eyes will open up a little bit, and I'll kind of see what the research shows on those things, and then I'll see a lot of times like I have access now to journals and to the researchers and educators from the programs that I've gone through, and I look at their comments, like for example, with the ketogenic diet, which we've talked about a lot, and just look to see, well, how do athletes use this, and what has the research shown, and try to look and kind of see, like, is there a place for that in my practice, or is there a place for this in somebody's healthcare? And so it's an evolving thing. So
So let me stop you there. So that brings up a really interesting point. I think this is something that I've noticed with you, is that you don't get rocked off your foundation very easily. Like you have a way of discerning information that I don't see very often. Like when I'm talking to other providers, or just kind of listening to people, and how they're growing professionally. Can you share like how have you honed in on that to not get sort of thrown off by kind of the latest and greatest?
I think it's probably there are people that I really respect in the fields of nutrition and exercise science, and I look to them and I look to their comments. And so, you can get really caught up on social media and see people saying things that kind of appear to be extreme. And I'll just kind of come back to where the research is at. Like, so for example, when the whole ketogenic diet came out, and athletes were using it and making claims of performance enhancement, and more people were talking about using intermittent fasting for weight management. I started looking at some of the position stands from these large organizations, like, again, the International Olympic Committee or the ISSN, and they just kind of seem to synthesize the full body of literature that's out there, and say, okay, well, this is what the body of literature shows. And so for me, it's like, okay, you can get excited about some of these things because like people make a big stink out of things and get excited. And it's really easy to you find somebody who's very dynamic and say, well, this must be like a cool thing, this keto or whatever it might be. And it's, people want to kind of jump on that bandwagon and follow a leader, especially if they're very dynamic. And for me, I want to jump on the bandwagon and follow the researchers. And so,
okay.
So, I'll look at, like, for example, Louise Burke is a name that comes to mind. And she is one of the tutors in the International Olympic Committee program, but also probably one of the most respected sports nutritionists in the field. And I look at her comments and her way of kind of looking at what is happening biochemically, physiologically, and so on, and then what happens when we apply these principles to athletes. And so I guess what kind of brings me back to the foundation again is the literature. What is the research showing?
Okay. So it sounds like, one of, in your practice of learning, some of these extensions of diet, nutrition, and lifestyle have kind of strengthened your resolve of the foundations of good athletic performance and sort of nutrition that's ideal for metabolic flexibility. Is that fair to say?
Exactly. And there's it's just, just understanding the basic biochemistry and the physiology and the needs of a sport, for example, or the needs of a person in their general life kind of helps me to figure out what the best program is for them. And N equals
Yeah.
one in general, right? Like everybody has their own biochemical individuality, but when it comes down to it, if you can apply these general principles, then most people are gonna get results.
Right. Yeah. So I guess one of the things just that I've noticed is you're trying to save the carbohydrate from extinction.
Yeah, I think the carb gets a bad rap for sure. And I mean, if we want to go down that pathway for a second, I think that carbohydrate is one of those nutrients that needs to be periodized, meaning it needs to be taken based on somebody's activities level. So from like let's say somebody says, well, they're going to go on a low carb diet. Well, if they're going to be a sedentary person, they don't need the carbohydrates. They can get away with having more of a higher fat diet because based on physiology and biochemistry, that's the type of substrate they're using for energy. Now, somebody like myself or you or an athlete that's going to go out there and do some more higher intensity and needs to have the carbohydrates because that's the main substrate for fueling their performance, then that's a different story. And there's also recovery things that you need to consider too that carbohydrates help to provide in terms of the adrenals and the immune system.
Yeah. Good point. So yeah, I mean, I really have appreciated that insight. I think that's individualized approach to nutrition and, to work with the individual and their needs based on, how much movement they're getting, how much exercise, and, sort of their general lifestyle. So I think that's, I guess, teaching people to learn their own needs and adapt rather than kind of stick to some type of template.
Yeah, I think like in the sports industry, and personal trainers do this a lot. They come up with what's called a needs analysis, and that's like when your patient or your client comes in, what are their needs? Like, what are they trying to accomplish? And then you need to figure out, well, where are they at now? And then you need to come up with a timeline or some kind of like path or route that's in a reasonable way going to take them from where they are to where they need to be, and kind of give them the tools. And I'll give them the tools with diet, exercise, and lifestyle modification. And generally, that seems to be the most effective way that I've found to help people.
Great. Well, this really helped me, a lot, and I'm sure it will help a lot of the listeners just to kind of learn how to be discerning and learn how to kind of come back to the foundations and to, kind of make sure that whatever recommendations they're following, they are, sort of thinking about what their individual needs are and to discuss that with a practitioner, so that they have the best outcomes. So, Geoff, if people wanted to learn more about you or more about this kind of approach, where would you guide them?
Well, for me, my practice is in Kirkland, Washington, as you mentioned, and my website is www.drgeofflecovin.com. And if you went to my website, I've got a lot of blog posts that I've written over the years on these topics that we've discussed. And then also, if you were to Google my name and NASM blog, there's also quite a few blog posts that I've written for the online National Academy of Sports Medicine blog that has to do with nutrition and exercise and health management types of things.
Okay, great. And then let's see. I have a question. When's your book coming out? I've been after you for years.
I know. To be determined.
Okay. Well, I'm going to keep after you on that. So, hey, thanks for coming on. It was great connecting with you. I always learn a lot from you, and we'll catch up another time.
Sounds great. Thanks for having me.
Thank you for tuning into the first episode of One Thing with Dr. Geoff Lecovin. This is Dr. Adam Reedy. I'm just going to share some concluding thoughts on the episode. What I learned most about talking to Dr. Lecovin is his continued emphasis on the foundation. He has repeatedly stated over the course of his career about the importance of good sleep, consistent exercise, and making good nutritional choices. And I think everything on top of that seems to be beneficial only in the context of how well you're doing the foundational lifestyle choices. And this doctor has not wavered from this. I've known him close to 15 or 16 years now, and I've not seen him waver on this. And he lives that lifestyle. And I think people who do listen to him and follow his guidance see the benefits of this approach. It may seem basic, but we're so often caught up in the latest supplement, the latest dietary strategy to trick the metabolism in doing something that it's not currently doing. However, if we're consistently working on good caloric balance, also working on restful sleep, and also implementing a regular exercise program, that is far head and shoulders above most people. And if we look at healthy populations, this is a consistent part of their life. And so I think skipping over that and trying to go into a kind of extreme diet doesn't make a whole lot of sense for the long-term success of that lifestyle change. So I really appreciate that he's stayed true to his self throughout the course of his career. Metabolic flexibility is a big topic. I'm going to share more about that on the page for this show on my website, and we'll kind of dive in and put some resources on that, on how to make sure that you stay metabolically flexible, or how to work towards becoming more metabolically flexible. Thanks for tuning in. This is Dr. Adam Rindy. We'll be back next week.